Hello friends, welcome to MusskilAsan. I am Dcosta, clinical psychologist, National Institute of Behavioral Sciences. A virtue at present, can it be a disorder of the future? Now, many children think that being clean is a wonderful thing. It is in most cases. And parents really appreciate it because children are keeping their rooms clean, they like to keep things in a particular order, in a particular fashion, and many parents boast about it. Our child just likes to keep things prim and proper. He's so particular regarding his work that till he doesn't get it right, he doesn't give it up. And that's definitely a trait of a perfectionistic person. So whatever he does, it's perfect. Let us talk about when it's not perfect. It causes distress, it causes anxiety, it causes anger. Now, this virtue, which is being perfect or being excessively clean, being, keeping things in a symmetrical order from high to low or fat to thin or in a particular color fashion, in a particular color coordinated way. They think it's wonderful to keep things in that order. However, now that's a virtue. But for how long? It starts causing distress to individuals when they start growing up. Now, obsessive compulsive disorder is a disorder that is usually diagnosed adults. When adults are unable to control their anxieties regarding particular behaviors, they seek treatment, and that is when we psychologists usually find out certain specific traits of obsessive compulsive disorder present in the individual. Now, when we find the individual, that's already a full-grown tree. The seeds have been planted when the individual was a child. Now, for that we have to understand what is obsessive compulsive disorder. Now, it has two main parts. One is obsession, another one is compulsion. What is obsession? Obsession are thoughts, images, ideas, or impulses that keep coming to the mind in a stereotyped form. And what is compulsion? Compulsion are ritualized acts that are also as a form of stereotypical behavior. Now let us find an example. When an individual walks into the room, he or she finds the room dirty, feels distressed, and wants to clean it up. Now that's a virtue. When you come into the room and you find the things dirty, it starts creating excessive anxiety. The things have to be in a particular order. How is it so much dirty? How come things are not in this way? And when you're anxious, when you're angry and you have to clean it up right at that moment, that's a disorder. How come that's a disorder? Well, that creates anxiety. It creates anger. Now, if a person who doesn't have OCD and still wants to clean a room because he or she is free during the day, that is not a disorder. When the thoughts, the repetitive thoughts, start creating the distress in the individual, that time we say that it is a disorder. Now, children, this is very rarely seen in children, especially regarding cleanliness. What they start doing is, this is also because children are very observant and either of their parents, either the mother or the father or any elderly caregiving person must be having this disorder at home. So the children start learning from them, and whenever they are keeping the things excessively clean, they are praised, and when they are not keeping it clean, they are not. In fact, they are criticized. So when they keep on indulging in this task because they are praised by the elderly person, it starts being inculcated in them as a virtue but starts growing as a disorder. When the things are not in that particular fashion, they start feeling distressed. Now, when you're at home, things are under your control, so it's fine. You don't like the bottle to be on the right hand side, you want it to be on the left hand side, you can keep it. But when you're going out and you're seeing things not the way you want them to, you start feeling anguish. Now, these thoughts, they sometimes, you don't like seeing dirty things and you want to clean it up. That's fine, as I said before. But this need for cleaning things, this excessive cleaning or washing, in certain cases we also find checking behavior. Children sometimes always fear that they are going to be harmed or something is going to happen to them, or maybe they are not doing things in the right order. Nobody knows what this right order is, even the individuals themselves or the kids themselves. But they are always thinking they are not doing things in the right order. And so that what they do is they check. So once they check, they feel relaxed. But again, after some time, the thought again keeps coming up because the thought is repetitive, the thought is forceful, and the thought does not go in with the personality of the individual. The person knows how to do this task, but still the thoughts are going on coming. Maybe I'm making a mistake. Maybe I'm not doing it in this right form. So they again go into a repetitive act. What is the repetitive act? They will check. Sometimes they think the room is dirty, they want to clean. So the thought that it is dirty, that is obsession, and they have to clean it 3 to 4 times. That is a compulsion. They think that it's not perfect and they have to keep checking it over and over again. That is a compulsion. Now you've written an answer and you want to check your answer. That is fine, definitely. We all like to see whether, it's all right or not. But children who have OCD, what they do is they write, they think they've made a mistake and they scribble it and they write it again. And then they will scribble it again and then they will write it again. Can you imagine the pain of the child? The amount of doubt the child faces. Now when these features start growing, because initially when this disorder begins, the amount of time that the individual spends in obsessing over a particular thing and performing the compulsive behavior, the time is long. Maybe they want to check if they've done something right or not, so they have doubt and they check it and then they feel relaxed for a long period of time. However, as this disorder grows, this relaxing point which comes later on starts reducing. So they think they've made a mistake, they check it, they feel relaxed, and then the thought comes in again, maybe I've made a mistake, and they again check it. And again they relax, but again the thought comes in. So they are in a vicious cycle. And because of that, they are unable to do their other task. They are unable to concentrate in their studies. They are unable to interact because they are all the thoughts that maybe it's dirty, maybe the person is spitting on me, maybe I've made a mistake, maybe I'm not going to say the right thing, maybe while talking I'll start abusing. These are the kind of obsessive thoughts. It doesn't go in with the personality of the individual, but they are forceful and repetitive. So when these thoughts keep on coming, they start creating distress, because of which their interaction is also disturbed, their performance is also disturbed, as well as they experience anxiety and anger and a need for control. However, there is definitely treatment for this and we are always there for you. If you think that your child has these particular symptoms, you should definitely get professional help. Either help from a psychiatrist, psychologist, but help is definitely necessary, because as the individual keeps growing, the disorder also keeps growing. And when the child is small, the disorder is also small. But when the child keeps growing, the disorder grows faster. So we are going to end it here. I hope you've liked this, and if you did like our video, so do like, share, subscribe, and see you next week. And if you want to know anything in details, do write to us.